I'm Molly Thomas in Toronto. Anyone that lives in the city knows that space is a massive issue. So what do you do?
When thousands of asylum seekers are filling your city shelters?
Well, you have to build. And that's what Canada's largest city is doing right now. They're putting up 3 to 4 temporary structures to just fit that need. And these numbers are unprecedented. Let me just show you just how busy city shelters are right now. The city of Toronto says 45%, about half of all people living in shelters right now, are asylum seekers or refugee claimants. If you look at 2017, that number was just 25%. Take it back another year, we're talking about 11%. Put this on top of the fact that the city has more than 5,000 people already homeless trying to find a place to put their head. This is 701 Fleet Street. We are in downtown Toronto, and by November, this is going to be the spot where the city puts up its first temporary shelter. So you can see some of the chalk drawings that are already on the line all the way around. It gives you an idea of how big this structure is going to be. Now, when it's complete, it's going to house 100 people. Now, 100 people in this structure, basically on cots in a massive room. There's going to be 7 showers, about 14 toilets for all of the people that are living there. Of course, the structure will be connected to city services like water, heat, natural gas, and each of these structures is slated to cost $2.5 million. To say the city and province are upset would be a massive understatement. It has been a mad scramble the last few months to figure out where do these people live. We've had asylum seekers in college dormitories. We've also had more than 1,700 people living in hotels. But who foots that bill? There's been tense negotiations between all 3 levels of governments fighting over just that, and winter, of course, is coming. The federal government gave Toronto $11 million. The city says that is not enough. They actually are dealing with more than $64 million to recoup costs by the end of the year. The province puts that number at more than $200 million right now. And this problem shows no signs of slowing down. We are seeing more than 15 to 20 asylum seekers enter the system every single day.
Limited healthcare services are available to refugee claimants through federal programs or through provincial plans. But those with a precarious immigration status still struggle to find healthcare in Canada. Molly Thomas spoke to a doctor in Toronto who treats uninsured patients, and they discuss who she sees on the front lines and who falls through the cracks.
You know, we've seen numbers at the shelters, for example, in Toronto rise. We've seen more and more refugee claimants in those shelters. Are you seeing those same people walk through your doors here at the clinic?
Yeah, definitely. I think it's unclear whether there's been a general increase in the number of refugee claimants across the country, but we do know that we are seeing a little bit of an increase of people who are specifically leaving the US to come to Canada and make a refugee claim that may have otherwise made that claim in the US. So I've seen people like that who very clearly state that they feel that the US is not a safe place for them, and they felt that they had to come here to make their claim to be prevented from being sent back to a country where they would be in danger. We need to be thinking of expanding sanctuary cities to sanctuary provinces, and we need to be thinking about how people can access the healthcare they need regardless of their immigration status.
Do you also see people that you think are taking advantage of the system? Because you're frontline, right? You're seeing the services rolled out. I think that's a genuine concern for a lot of Canadians.
Yeah, I can understand how that's a concern, particularly if they're not in the service provision role. So it's really, again, easy, I think, for people that may stand to benefit from propagating that view. So if they, for example, certain politicians may want to suggest that people are coming here and taking advantage of the system. But that's not really something that we see on the ground. We see people that are desperate, they're coming, and also extremely resilient. But if people are here, they've often journeyed far, and they've come for reasons that are completely understandable from a human perspective.